Okay, welcome po. Good morning, good afternoon, good evening po sa lahat. Welcome to a 162nd episode of Stop COVID Deaths webinar series brought to you by the University of Philippines. Thank you for being part of our credible online community. And to all those who have just discovered us today, welcome po. Sana po marami po kayong matutunan sa ating webinar for today. In a world marked by increasing diversity and inclusivity, the imperative to understand and support sexual and gender minorities has never been more evident. We hope to be able to offer a holistic perspective in this webinar on the unique healthcare needs, challenges, and disparities experienced by sexual and gender minorities, while also finding a way to empower healthcare professionals and other stakeholders with the knowledge and compassion necessary to provide care not only medically sound, but also culturally competent and sensitive. I'm Dr. Raymond Francis Sarmiento, Director, National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during a regular Friday. For this Friday, medyo special po ito. Solo flight po tayo, but we wish Dr. Susie Pinada Mercado safe travels. She's traveling and just talking to embassies po with regards to her initiative with the World Health Organization. At this point, we'd like to greet all of our participants who are live in the broadcast po for Zoom webinar, all those who are watching via live streaming on the TVUP YouTube channel, as well as on the UP System Facebook page, TVUP Facebook page, Stop COVID Deaths Facebook page, and of course, all those who are watching us in the playback as well as in TVUP Signal TV Channel 101. So this week po, we'll be talking about a very, very complex and intricate topic, and we hope that you'll be able to learn from our distinguished panel of experts for this week. So for this week, our main speaker will be the Chief of the Division of Sexual Health at the UP Philippine General Hospital Department of Obstetrics and Gynecology, Dr. Sherry Ann Suplido. With our reactors, we have two for today. We have the Professor and Vice Chair for Training of the PGH Department of OBGYN, Dr. Mario Festin, and the Chair of the Project on Sexual and Gender Minorities from the Philippine Obstetrical and Gynecological Society, Dr. Amy Lopez. Very special din po dahil ang ating synthesis and closing remarks will be delivered by Dr. Angela Season Aguilar, who is Special Assistant to the Dean for External and International Linkages of the UP College of Medicine and the Philippine General Hospital. All right. As you have seen po in our opening billboard, we have transitioned into our broader discussions on how we deal with preventable deaths and certain health topics that affect health outcomes that are beyond COVID-19. So yes, we have maintained yung pong title po ng ating programa, Stop COVID Deaths, but we have expanded our discussions. And since we know that you like to always be abreast of the latest news in health and medicine here and abroad, we have a segment in the webinar called The News Update. Okay, thank you so much for our very first news update. So both of our news updates po really are from the World Health Organization. But first of them is the WHO initiative in terms of signing new licensing agreements on COVID-19 technologies. Yung CTAP po, which is the COVID-19 Technology Access Pool, is a multi-stakeholder partnership to facilitate the sharing of intellectual property, knowledge, and innovations. And this has announced 3 new licensing agreements acquired through the Medicines Patent Pool. These agreements include the following licenses to transfer knowledge, materials, and clinical data needed in different countries. So first of them is Medigen Vaccine Biologics Corporation, the first private manufacturer offering its patent and knowledge or know-how for a COVID-19 vaccine that has seen more than 3 million doses administered across 7 countries. It's the very first time that a vaccine manufacturer is using the WHO CTAP model. Again, yung CTAP po is COVID-19 Technology Access Pool, a win-win opportunity for the manufacturer, recipients of the technology, and pinaka-importante, patients in need around the world. The second agreement po is with the Spanish National Research Council, sharing a second license for a COVID-19 vaccine prototype, which includes yung agreement po includes plant visits and training, direct assistance, and ongoing consultation with recipient manufacturers, including quality and regulatory matters. And then finally, the last agreement po is with the University of Chile, who is sharing their technology for a COVID-19 assay for quantification of neutralizing bodies. So very, very important and significant steps with regards to these licensing agreements that will be very important for us as we try to leverage COVID-19 technologies moving forward. For our second naman po na news update, our second news update is about a groundbreaking air pollution po na training launched by the WHO for health workers on International Day of Clean Air. Alam niyo po ba yan? Did you know that we had an International Day of Clean Air? So most health professionals training curricula po kasi do not sufficiently address the health impacts of air pollution, with only approximately 11% of medical schools around the world including air pollution as a risk factor for health as part of their formal education. This is according to a report from the International Association of Medical Students Association. This first online course pa lang po siya, is a WHO online course on air pollution and health for health workers, will be launched at the margins of this year's International Day of Clean Air for Blue Skies. It's Blue Skies. It's a landmark collaboration po with over 30 international experts. The WHO developed the first air pollution and health training toolkit specifically tailored for health workers to be unveiled towards the end of 2023. This user-friendly open WHO, para po siyang MOOC, which is our massive online courses na meron po tayo, open source na online courses, will coincide with this year's International Day for Clean Air for Blue Skies. And this strategic move reflects the commitment to addressing air pollution concerns and fostering healthier conditions for everyone. Because air pollution threatens the global economy as it imposes enormous health costs, representing 6.1% of the global gross domestic product, which is more than $8 trillion noong 2019 alone. And that's it for our news update. These are just some of the stories that we are keeping an eye on and why they are relevant to you. And we hope to see you again next week for our news update next week. Okay, as mentioned po, no, tuloy-tuloy lang po tayo, and for those who are just catching up right now, mag-isa lang po tayo, but we, as mentioned, we wish Dr. Susie Pineda Mercado all the best in her travels, and safe travels po, Ma'am Susie, while you are there and in the Marshall Islands. Okay, back to our webinar topic. So raising awareness po on sexual and gender minorities, and we hope to be able to provide excellent insights, and hindi nyo po yung naitatanong, while TVUP team is working po dito sa ating person on the street video, very, very important po yung mga tinanong po nila for our audience. And I've had a chance to get a sneak peek on that. The questions that we post, the common folks on the street, may alam po ba kayo tungkol sa gender minorities? Sino sa tingin ninyo ang kabilang sa mga gender minorities? We also tried to interview those who are part of the LGBTQ+ group. Alam nyo ba kung saan magpapatingin kung meron kayong sexual concerns? Alam nyo ba kung ano ang mga sexually transmitted infections? At na-experience nyo na bang magpa-pap smear, magpa-screening test? At alam nyo ba kung kanino kayo magpapakonsulta? So please watch this.
Sila yung mga gender na hindi masyado ina-acknowledge ng lipunan natin.
Yes, I have idea on gender minorities.
Pagkakaalam ko po, ang gender minorities, yan yung umbrella term para sa mga miyembro ng LGBT.
Ang mga kabilang sa mga gender minorities, yung mga lesbian, bisexual, gay, transgender, yung mga queer sa ating lipunan.
LGBTQA+ community belong to this group of gender minorities.
Sa natin sa LGBT, lesbian, gay, bi, bisexual, transgender, at marami pang iba.
Meron tayong tinatawag na, ewan ko kung kasama dito yung likhaan clinic. Pero alam ko mas more on sa ano sila sa contraceptives. But kung magpapacheck kayo or magpapaconsult kayo about sa sexual concerns, siguro better na pumunta kayo sa mga gynecologist. Ayun.
We have our sex therapist na meron din sa ating mga LGUs na or center na nagbibigay din ng libreng pakonsulta.
I believe na yung every barangay merong parang health center where people can go there to check their health status.
So itong mga sexually transmitted infection, usually nakukuha sila sa sexual intercourse primarily, lalo na kapag mayroong intercourse na nangyari. At mostly nangyayari to kapag unprotected yung sex, kapag hindi sila nag-wear ng condom.
Ito yung STI or STD. Ito yung mga bacteria or viruses na nakukuha after sex.
I have friends who go there na supportan naman sila and maganda siya at masaya rin na somehow mayroong safe space for us.
I have no idea what is pap smear is, but I'm very open if there's a chance or if I'm given a chance to do that.
Not yet, but I want in the future kasi importante na as younger na age na 20s, kailangan makapagpa-checkan na kasi lalo na sa mga babae, meron tayong mga hormonal imbalance na hindi natin alam kung ano yung nagiging effect sa atin, kung bakit tayo ganito. So, I think in the future, I want to.
Okay, thank you so much. TVUP always very enlightening for us to know more about what people on the ground are thinking and how really it influences us in terms of what needs to be focused on in our presentation. So just a little bit of housekeeping for today. For all those who are asking, certificates of attendance have already been given out for all webinars po, webinar 1 to 161, which was last week, our first episode on health lead, including po webinar 150 on climate change, which is a sea level rise. Those who have watched at least 50% of the webinar duration will be the ones eligible to receive certificates of attendance. So if you feel you should have received one but did not, please let us know by emailing us at stopcoviddeaths@up.edu.ph. Okay, so before we proceed for the topic at hand, we just wanted to remind everyone that we'll be having a standard panel discussion format, and after our speakers are presented, that will be followed by a Q&A session. But before we delve into the webinar proper, we know everyone is very excited for our fun quiz. So we have this cute, very, very short introduction video for our fun quiz segment for all of you.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Trucy, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, thank you so much, TVUP. Can we go ahead into our fun quiz for today? Can we have it on the Zoom as well as in our Slido po? Okay, so while that is being brought up by the team, we hope to be able to, can we just launch it right now? Okay, there we go. Those who are joining us outside of the Zoom, you can participate still in our fun quiz by opening up your browsers and entering in the address bar slido.com. And when you are prompted, you enter the code 6510096. That's 6510096 for you to be able to participate in our fun quiz segment. We have two questions for today's fun quiz segment, and these questions are as follows. Number one, what screening test should lesbians undergo? I repeat, What screening test should lesbians undergo? Is it A, pap smear? Is it B, breast exam? Is it C, bone mineral density? D, all of the above? Or E, wala po sa nabanggit, none of the above? We'd like to greet those who are joining us all the way, at least locally po, no, from the Provincial Health Office of Kaanawan, San Jose, Nueva Ecija, in Chongwayu Hospital in Cebu City, Cebu, Mabuhay St. Francis of Assisi Clinic, Mondragon in Northern Samar, Iligan City Health Office in Iligan City, Lanao del Norte, Margo sa Tubig Regional Hospital in Zamboanga del Sur. Those who are joining us also from Hospital ng Binyan, from Deca Homes Loma de Gato in Marilao, Bulacan, from ASA Philippines Foundation. Maraming salamat po. Those who are joining us also from FEU Critical Care Unit, from Iloilo City, also from the University of Santo Tomas Hospital, ENT HNS Center. Maraming salamat po, mga masugid po nating mga viewers. From University of Philippines, La Consolacion University of the University Philippines, Malolo City in Bulacan, University of the Philippines in Diliman, and in Los Baños po. Thank you so much. Those from Bataan, maraming salamat po sa inyong pagsubaybay. University of Rizal System Health Services and RPHS Annex 1 Antipolo. From the Philippine General Hospital, from Morong Rizal, maraming salamat po. For question number 2, reads, can we have question number 2 in Slido po? Thank you. For question number 2, what is the best way for transgender woman, what is the best way for a transgender woman to have feminine features? I repeat, what is the best way for a transgender woman to have feminine features? Is it A, OCPs, or oral contraceptive pills? Is it B, oral estrogen? Is it C, testosterone? Or is it D, letrozole? So may pahabol po. Thank you so much. And good afternoon po from Fabelia Hospital. But internationally, we are also being viewed from the Chonin Hospital in Taipei City in Taiwan, from Mentari Intercultural School in Jakarta, Indonesia, from Los Angeles, California, United States, Canadian Medical Center, Dammam, Saudi Arabia, University of Hail in Hail, Kingdom of Saudi Arabia, HSWC in Hail, also Saudi Arabia, and the University of Fiji in Lautoka in Fiji. Maraming salamat po. So, for those who will want to still participate dito po sa ating fun quiz, please go ahead and enter your answers po. No? We will leave the Zoom poll open at ito rin po si Slido as we continue with our program, and our speakers will comment on the answers later on the correct answers later on during the panel discussion. Okay? So we know everyone very excited to get the webinar underway. Let me introduce our main presenter for this week's webinar. So for this week's webinar, we bring you siyempre, we bring you only the best po, no, for our webinar, and something that we're very proud of as part of our program. For this week, we have as our main presenter, main speaker po, the Chief of the Division of Social Health at the UPPGH Department of Obstetrics and Gynecology, none other than Dr. Sherry Ann Suplido. Dr. Sherry.
Thank you very much, Dr. Raymond, for your very kind introduction. Thank you po for the invitation to be here.
Thank you so much, ma'am. Go ahead and share your screen po.
Okay. Okay, good afternoon po everyone. Maraming salamat po sa pag-imbita sa akin dito, and thank you very much again for the opportunity to give you my lecture and raise your awareness on sexual and gender minorities and how to take care of them and their health care. So let's start with a typical scenario in the clinic. Priscilla is a 34-year-old transgender woman, or a trans woman. She came to the OBGYN clinic because she has questions on her medications that she's taking for transitioning. So she goes into the receptionist or the secretary. Secretary hands her a form so that she can fill in her general data, and under gender, she placed trans woman. So she gives it back to the secretary, and upon reading the word trans woman, the secretary says, hindi ho kayo dito kasi babae lang po ang tinitingnan namin sa clinic, sa OBGYN clinic. So humiliated and with feelings of discrimination, Priscilla goes out and cries, no? So this scenario is quite it is often experienced by our sexual and gender minorities. So they're often victims of stigma and discrimination. So as healthcare providers, we know that there's a growing concern. So we have to also have a growing commitment to understand and improve our sexual and gender minorities clientele in terms of their healthcare and well-being in the community. So what is sexual and gender minority? So this refers to a group of people whose sexual orientation, identity, or reproductive development differs from the traditional, societal, cultural, and physiologic norms kung ano po yung nakagisna natin as being male or female. So in 2019, the National Institutes of Health expanded the definition of SGM to include individuals experiencing health disparities that are not studied as much. So kasi I saw our persons on the street, no, when they were asked about sexual and gender minorities, most of them know about it. But this, the term should not include, should include but not be limited to individuals who identify as lesbian, so the LGBTQI, lesbian, gay, bisexual, asexual, or transgender, or even yung term na two-spirit, queer, and or intersex, and exhibit same-sex or gender attractions or with a difference in sexual development. So the term SGM is more inclusive. So in 2018, we are proud in the Philippine Obstetrical and Gynecological Society under the presidency of Dr. Elisa Tiu. She has a presidential project and she came up with the project on sexual and gender minorities of the Reproductive Health Committee, because we in the society we learned that there is growing number of our clientele coming into the clinic. So as OBGYN, sometimes if we don't know how to take care of these patients, di mahirap po yun, ano? So we now, it's already 2023, so 5 years old na po itong project namin on SGM. Also, just in 2021, so this is the 9th and youngest division of the Department of Obstetrics and Gynecology of the Philippine General Hospital. This is the Division of Sexual Health. So but this is not just limited to our trans or our SGM clientele. All clients of different identities, expressions, or orientation. So, but we cater to their healthcare as well. So, ang pangalan po ng clinic namin ay Open Doors or Pintuang Bukas, because we want to be culturally welcoming to all our patients. So, ipa-plug ko na rin po, no, any concerns on sexual health, regardless of your gender identity, expression, or sexual orientation, you can come into the outpatient department of the Philippine General Hospital from 8 to 4 p.m. You are always welcome if you have any concerns as regards your sexual health. So going back to sexual and gender minorities, this is preferred over the letters that we know, no, LGBTQ+, no? So because it is more inclusive, I've mentioned before, and it acknowledges all individuals of diverse sexual orientations and gender identities, kasi may ibang hindi magpo-fall particularly in one letter only, no? So let's go to the statistics or epidemiological data on SGM. So unfortunately, it's very limited. So we still lack large-scale health surveillance and population-based studies on this group of clients, no? So national health surveys rarely include questions pertaining to the respondents' SGM status, no, orientation, or transgender inclusive gender identity measure. So in 2000, the US Census reported approximately 1.2 million individuals living with a same-sex partner, or 150,000 youth and 1.4 million adults living in the US identify as transgender, whether male or female. So if international data is limited, mas limited po sa atin, no, in the Philippines. So although there are isolated studies, 11% of sexually active Filipinos aged 15 to 24 years old had sex with the same-sex partner, and 87% of which were men having sex with men. 15% of sexually active men had engaged with sexual acts with men, while 4% of women had them with fellow women. So Same-sex prevalence in the regions was high in the Visayas and some in northern Mindanao. However, we don't have accurate statistics on the trans population in our country. So as OBGYNs, frequently you'll see the term OBGYNs, obstetrician, gynecologist, kasi ganun po ako, no? But any healthcare provider knowledgeable on SGM healthcare can take care of an SGM clientele. So it is important for us healthcare providers to be familiar with the terminology kasi yun yung una no? So that's the basic one. So when caring for our SGM patients. So let's start with the basics. When we say sex, what is sex? No, hindi yung sex the act, no, but in the noun. Sex, this is the presence of specific anatomy or chromosome. So historically, this is the sex assigned at birth. No, yun yung nakalagay sa birth certificate natin based on the external genitalia as well as the chromosomes and gonads. So this is what we call us as OBGYNs pag nagpapaanak kami when we deliver, and then whether cesarean or vaginal delivery, paglabas ng baby, that's when we say baby out, the time, 9 o'clock a.m., baby girl. No, that's what we call out, baby girl or boy. But this term is used interchangeably with gender. However, there are some nuances, no, which is important, particularly for our transgender clientele. What is gender? So this is a social construct made up of attitudes, feelings, and behaviors that the culture associates with either being male or being female. So if you are a cisgender female or cisgender male or cisgender, this is a term used to describe a person whose gender identity aligns with that was typically assigned to his or him, her or him at birth. No? So, ayan. So, what is a gender nonconformist or what is gender nonconformity? So this is the extent to which a person's gender identity, role, or expression differs from the cultural norms described for a specific sex. So malaki talaga yung impact ng culture, no, sa atin kung sino ang babae, sino ang lalaki. So kung nonconformist siya, the gender identity differs from that which was assigned at birth, but medyo multifaceted and fluid to compared to a transgender person na mas defined. So we will be going through the definition later. Okay, so what is sexual orientation? So this describes the sexual attraction only and is not directly related to gender identity. Hindi dahil identifies siya as female, ang orientation niya it's towards a male. So ito, itatanong natin to sa patients natin, no, or clients natin, no, if they don't have any illnesses. In our clients, they should be defined by the individual, and this is based on lived gender. So ito na, malilito-lito tayo ng konti. A transgender woman attracted to another woman would be a lesbian, and a transgender man attracted to other men would be a gay man. So medyo nalito tayo doon, no? Kasi orientation ang ating pinag-uusapan. Okay, so what is gender expression? This is the outward, so expression, no? Outward manner in which we express or display our gender. So this is seen with the way we dress, mas feminine or mas masculine, how we style our hair. Do we want a longer hair or shorter hair, or no, on how we talk and the mannerisms as well. Pero ngayon nga kasi wala nang rules, no? Pwedeng males can have longer hair but express themselves as male as well. So medyo yan. But this is the outward expression. So what is gender dysphoria? I'm sure you've heard of the term gender dysphoria. And this is different from gender nonconformity kasi ito naman yung the person's gender doesn't identify what he or she identifies with is not aligned with the sex assigned at birth. Or what the society or the cultural norms dictate. But if there is a distress that accompanies the incongruence, ayun, no, pwede na nating i-diagnose as gender dysphoria, and meron talaga tong specific diagnostic criteria. So if there's an incongruence between one's experience and expressed gender and one's assigned or sex assigned at birth, basta merong dysphoria, a distress, then it is gender dysphoria. But you have to fulfill the criteria first. So I've been talking about trans man, trans woman, transgender man, transgender woman. So what is transgender? No, this is an umbrella term attributed to a diverse group of people whose internal sense of gender is different than that which they were assigned at birth. No? So this refers to gender identity and gender expression. And again, I'd like to emphasize that it does not necessarily coincide with sexual orientation. So pwede siyang transgender female, hindi ibig sabihin ang orientation niya is towards a male. Kaya kanina yung example ko, a transgender woman, so born or sex assigned at birth male but identifies as female, so trans woman na siya, but attracted siya to another woman, di lesbian. Yun. Parang nalito tayo lalo. No? Okay, so I mentioned that as long as a person's gender identity differs from the sex that was assigned at birth, that a person is transgender. Pero overlap with the term gender nonconformist as well. So a transgender man or a trans man is someone who was female or sex assigned at birth, is female but identifies as male. That person has a male gender identity. A transgender woman or a trans man, someone with a female gender identity but was born male. Okay. If the person is non-transgender, edi cisgender siya. Aligned yung sex assigned at birth at saka yung what he or she identifies as. Okay. So, like Priscilla, our index clientele earlier, our trans men and women oftentimes face harassment, discrimination, and rejection within the society. O sa clinic pa nga lang, na-reject na siya. No? So if we are not aware, we lack knowledge and the sensitivity, we have our own biases as healthcare providers, it can lead to inadequate access to and underuse of and inequities within our healthcare system for our trans patients and of course our SGM patients. So lalo pa nating pahirapan yung mga sarili natin with the terms, but of course we have to be familiar with these as well. Genderqueer, no? It blurs the lines around gender identity and sexual orientation. So medyo mas fluid sila, no, in terms of gender identity and sometimes sexual orientation. You might have heard of the term gender fluid. So this is a term we now often hear if that person has different gender identities at different times. Sometimes nag-identify siya as female, sometimes nag-identify siya as male, di gender fluid siya. Or medyo gender queer. Ayan. Okay, gender non-binary. So this is a gender non-conformist or a transgender, so sex assigned at birth, not aligned with how she or he identifies with. It's an umbrella term for both the trans gender and gender non-conforming individuals, but they don't identify as neither male or female. So gender non-binary sila. Okay. Kasi kaya nga, pag nagsusoji tayo with anyone, we should ask that person. Hindi tayo yung mag-assume what their soji is. Okay, so the World Professional Association of Transgender Health states that the expression of gender characteristics, including the gender identity that are not stereotypically associated with one's assigned sex at birth, is common, no, and culturally diverse human phenomenon that should not be judged as inherently pathological or negative. So before nga, in the very early DSM or diagnostic criteria in our psychiatry books, ang homosexuality dati pathologic siya, no? Pero hindi naman na siya ngayon necessarily pathologic, although gender dysphoria is kasi nga may psychological distress, no, that accompanies the incongruence. Okay, so social and economic marginalization of our trans individuals and our SGM patients is widespread, which leads to healthcare inequities and poorer health outcomes for this population. So laging may barrier to their healthcare, so hindi natin sila masyadong aalagaan. So how do we now address these inequities, no, and their inability to seek healthcare? So we have to be inclusive. So as OBGYNs like myself and healthcare providers, we should strive to make our clinics open to and inclusive for all individuals who want to seek out education or counseling, or if they have a healthcare issue. Yan. So like Priscilla earlier, no, there may stigma, meron na kasi sila, ang barrier to healthcare is that minsan natatakot na lang silang pumunta sa clinic, no, kasi nga baka hindi sila papasukin, they will be discriminated or disrespected. Yan, kaya yun na lang sila magpapatingin, no? Yun yung mangyari. So if we are able to provide a safe and welcoming and culturally appropriate environment in our clinic, our patients, our clientele will seek healthcare. We want to ensure them, especially the sexual and gender minorities, that they can go to us and seek care when they have problems, and that we, as their healthcare providers, are able to take care of them with compassion and competence. So apart from medical care, no, kung meron talagang pathology, we can also provide them holistic care. So pwede kasi naman yung social or psychological issues as well. So our clinic is open to that. Yan. So like Priscilla, the issue about our, particularly yung trans, no? Kasi sila talaga yung marginalized, no? They're concerned about the way they're going to be treated, no, when they come. So sometimes if they want to transition or they have plans, they don't go to a healthcare professional and just obtain their sources, no, yung information from friends or unlicensed sources, o minsan sa social media. And of course, it's very risky because since they don't get their care from healthcare professionals, pwede talaga mag-morbidity, no? So getting care or accessing care from an OBGYN or a healthcare professional is challenging kasi nga, admittedly ako ngayon binabago ko na, no, ang kulay ng clinic ko is pink. No, kasi apart from I'm the chief of the Division of Sexual Health, I'm also a maternal and fetal high-risk pregnancy specialist. So una talaga pink siya. So it's very challenging. Parang meron ng doon pa lang nagiging exclusive na yung clinic for women. Ano? Very gendered and women-specific yung ating mga clinics. Yun nga, I've mentioned some have pink walls, ako yun. Tapos ang tawag pa sa clinic mo is Women's Wellness Center. So lalong deterrent for our SGM clientele to seek our help. Yan. So according to the American College of OBGYN, we should be knowledgeable while providing care and comfort for our trans and gender non-conforming SGM individuals. So we'll start by, so when we conduct our interview with our patients, we ask them of the pronouns that they are comfortable with or kung anong gusto nila. So it can be he, she, his or her. So how do you start it? Para they don't feel that they're targeted. Na ako lang tinatanong. You have to we can say that, for example, I'll say, hello, I'm Dr. Sherry Ann Suplido. My preferred pronouns are she and her. Yan, what's yours? Yan, para ano siya. Para very neutral yung start ng conversation and your patient will not feel targeted. And I've mentioned this and I cannot overemphasize, to make our clinic and chosen images very inclusive. So all are welcome. So you can have parang mga posters, signages, educational materials, artwork, representing all individuals who may seek healthcare regardless of your gender identity, expression, or sexual orientation. So you clearly post a sign in your clinic that you have a non-discrimination policy, or just make it yung may colors of the rainbow, all are welcome, yon. And then we also want to have gender-neutral restrooms. Yan yung laging nagiging issues ngayon. Ano? So, kasi may male, female, tapos saan. Nahiya sila minsan pumunta sa male bathroom if they are a trans woman, ganyan. For example, tas kung doon naman sa female, parang nailang din sila. So, you have to have gender-neutral restrooms as well. So, in our clinic, so when we give them a form, no, if they are new clients or new patients, we have to use forms that include tick boxes for all gender and sexual orientation options, or a blank so they can write down to ano. So in our clinic, there should be a system where the names used by the patients, pwedeng nandun, of course, it's a medical record, which is a legal record. So they have their legal names, and they can place the name that they want to be called. So apart from the pronoun during the interview, say, what name do you prefer, or anong gusto mong itawag ko sa iyong pangalan? Ayun. Okay, so ang maganda sa Tagalog actually, walang mga her. Yun nga, no? Kaya maganda pag naka-Tagalog, walang pronouns no? So it's safer actually. Ayan. But you ask the patient all the time what he or she's prefer. their preferred product. So, ayun. In the Philippines, unfortunately, the name of the client on the medical record cannot be changed. No, wala pa tayong masyadong yung legalities on that, hindi pa masyadong established at kailangan talaga kung anong legal name yun nandun. But ako, I also, in the clinic, I ask them to write yung name that they want to be called. Yeah, because of course, medical records are still considered documents of legal significance. So, although not as significant as yung mga passport or marriage certificates and school records. Ayan. So, ito yung dapat i-train din natin yung staff kasi pwedeng sa clinic natin, tayo lang yung knowledgeable about SGM healthcare. But what about our secretaries, our assistants in the clinic? They have to be trained also on how to their approach to the SGM personnel and how to apologize for confusions made if mistakes. Syempre hindi naman maiwasan yun. No? If mistakes do happen. So example, yung kay Priscilla, dapat mag-apologize yung personnel dun sa reception kasi pinalis niya si Priscilla. Yan. So now let's go to transgender healthcare. This includes prevention, diagnosis, and treatment of physical and mental conditions, as well as sex reassignment therapies for our trans individual or yung mga gender affirming healthcare. So the World Professional Association for Transgender Health came up with standard of care guidelines. Pero meron na tayong Philippine Professional Association for Transgender Health as well, which is a fairly new society. No, so we have guidelines that promote evidence-based care, education, research, advocacy policies, and with respect to transsexual, transgender health, so that our clientele can benefit from and have access to evidence-based healthcare, social services, justice, and equality. So para maalagaan natin sila. So this includes primary healthcare, gynecologic, urologic care, reproductive options, pati yung mga kung it's a gender affirming therapy na surgical, syempre voice and communication therapy, mental health services are very important as well, counseling, psychotherapy, hormonal and surgical treatments. Kasi when you say gender affirming healthcare, hindi lang naman ito yung nagpa-surgery siya or nagagamot siya, no? He or she is taking hormones. So when we say gender-affirming healthcare, it includes any single or combination of a number of social, psychological, behavioral, or medical, including hormonal or surgical interventions designed to support and affirm an individual's gender identity. Kasi hindi naman lahat ng, kunwari, trans woman, hindi lahat gustong hormones, hindi lahat gusto magpa-opera. No? So let's go back to our index clientele. Priscilla, a 34-year-old trans woman, yung kaninang napaalis from the clinic. So nag-sorry na tayo sa kanya. Nag-sorry na yung receptionist sa kanya at bumalik na siya sa clinic. No? And for example, gender reaffirmation ng kanyang concern. So I mentioned and cannot overemphasize again that each individual patient will desire different outcomes. Hindi naman yung iba na para kailangan talagang very feminine or very masculine. So not all patients will want hormone therapy and not everyone will desire surgery. So ask the patients kung or clientele kasi pwede naman wala silang sakit. No? Tinatawag lang natin silang patient kasi they came to the clinic. So ako, I want to get used to saying clientele kasi not necessarily may pathology sila. No? So medication and surgery are not required as parts of transition and should not be required for legally changing one's name also or gender marker on official documents like the legal documents, birth certificate or driver's license, ganyan. So hindi ibig sabihin kailangan nga mag-surgery or medication. So remember that although hormone therapy is a medically necessary treatment for many individuals, kasi nga they want to look more feminine or more masculine, with gender dysphoria, not all transgender patients experience gender dysphoria and not everyone desires hormone treatment. So hindi din baka sabihin nyo, yung mga trans, baka dysphoric sila kasi ayaw nila the way they look. No, not necessarily. Okay. And hindi naman necessarily that they have to undergo medical treatment. Pero syempre kung very dysphoric talaga, yun, most of them are require medical treatment. Yeah. So usually, so there are two schools of thought regarding this for gender reaffirmation. Usually there's a referral letter from a psychiatrist especially kung surgical, no, or mental health professional, required before starting a patient's gender-affirming hormone therapy. But in other countries, you just need an informed consent, no. So current consensus is that an informed consent process, only that is needed without a separate letter from a psychiatrist or mental health care professional. So pwede na basta naiintindihan niya, alam niya yung goals niya, just the informed consent. Yan. So locally, there are more unanswered questions, no? Yung mga ethics nito and legalities, no? Is it ethical or even legal to prescribe hormonal treatment who are not diagnosed cases of gender dysphoria? Yan. We know that oral hormone therapies used for cross-sex hormonal treatment are being used as off-label indications, no? Oral contraceptive medications, para may quiz tayo dyan kanina. So, ayun. So, pero kung dysphoric na yung patient, you can always refer to a psychiatrist, or you can ask their patient also if she is more comfortable in seeing psychological or psychiatric consult as well. So, let's go to hormone therapy. No? So majority of our medications used for gender transitioning are common and can be safely prescribed by a variety of healthcare professionals. So not necessarily gynecologists, pwede din internal medicine specialists or even family physicians if they are trained or they have adequate knowledge on how to take care of the SGM or the trans population. So ayan, pwede siyang OBGYN. Kaya lang syempre kung trans woman, gusto niya pumunta sa OBGYN. Yan. Pero pwede din other healthcare providers. So being knowledgeable about the medications that we use for transitioning, as well as their side effects, it's very important, no, before we prescribe them. Yan. Yan. So going back to Priscilla, na may question siya about transitioning. So before starting her on hormone therapy, you ask her what her goals are. Ano ba yung gusto niya? Gusto ba niyang magka-breasts? Gusto ba niyang pumino lang yung features niya? Ano bang ano niya as a trans woman? Or eventually, will she consider surgery? Yan. So you have to ask what her goals are. So cross-sex hormonal treatments, which either be masculinizing or feminizing, can be provided for in the clinic. So as OBGYNs or internists, endocrinologists, yan. So we can hone our skills by educating ourselves. Kasi wala talagang formal, like wala naman, like ngayon, wala naman pa kaming fellowship on, for example, or training on ganyan. No? But in the W path, you can be certified, yan, as a healthcare provider. Yan. Pero parang hindi pa siya kasama like in our training kung gusto mo maging trans care specialist. Yan. So W path has criteria for hormone therapy as follows. So ito, no, so pwedeng not necessarily, no, but persistent, well-documented gender dysphoria, which is diagnosed by a mental health professional. That person has a capacity to make a fully informed decision and consent for treatment, reach the age of majority. We have adolescent, din kasi, younger population na wants to go transitioning. So there are different rules, no, but here in the Philippines, no, we have encountered younger, so mga nasa adolescent na who wants to transition or plans on transitioning. Yeah, so dapat lang you're able to counsel them well. Yeah. So Priscilla is a 34-year-old trans woman who desires feminizing treatment. So you tell her, so her is her preferred, let's say her is her preferred pronoun, that undergoing feminizing treatment will decrease erectile function, testicular size, will promote breast growth, and increase body fat percentage. So, but usually there are no absolute contraindications to feminizing therapy, but you have to screen your patients, no, if they are or have venous thromboembolism, if they're going to give them oral estradiol hormones, hyperlipidemia, and they have increased risk for development of gallstones and liver problems with elevated liver enzymes. So dapat safe muna for our patients before we embark on feminizing treatment. So they should be counseled also and tell them of the risk factors if they are at risk for cardiovascular disease, like smoking as well. So kailangan din, no, make a thorough history. Okay, so this is a summary of the hormone preparations for feminizing hormone therapy. And so you have oral, parenteral, transdermal, and anti-androgens as well, which we can prescribe our patients, our clientele. Okay, so if we are going to use oral estrogen, 17-beta estradiol preparations are preferred. And sa lahat naman, we want to prescribe the smallest dose possible to achieve the desired effects. So you have anti-androgens, like spironolactone is a diuretic, but it is it's anti-androgenic. Cyproterone acetate, these are hormones, GnRH agonists, and 5-alpha reductase inhibitors. We can reduce their testosterone levels para mas mag-feminine sila. No? It will decrease their masculine characteristics and decrease also the amount of estrogen which they need. Yeah. So ethinyl estradiol provides better cycle control, increase the risk of VTE, but may increase the risk of thromboembolism. So, but hindi naman kailangan ng cycle control sa trans woman kasi born male sila, no? So, its use is not indicated. So, there are also transdermal preparations. Yan. Pero, more often than not, oral preparations po yung ginagamit. So, anti-androgens like spironolactone inhibits the secretion of testosterone, pero it increases, may risks siya, no? So, you have to be able to potassium sparing kasi siya, so may risk for hyperkalemia as well. So you have to really screen your patients. So the doses should be titrated to physiologic effects while adjusting the estrogen and anti-androgen doses until it's in the female physiologic range. So tinatitrate up lang siya, no? And then of course you watch out for side effects. So if the patient is taking a potassium sparing diuretic as an anti-androgen like spironolactone, you have to check potassium and creatinine or renal function levels every 3 months for the first year and then yearly thereafter. Yeah. So the goals to maintain estradiol levels daily, less than 200 nanograms per ml, and testosterone in the female range of less than 55 nanograms per deciliter. Tsaka makikita mo din yung feminizing characteristics. Yan. So your progestins may also increase breast development, improve libido and mood in some patients. So, but if they're on feminizing hormone therapy, they have to be monitored by diagnostics. So every 3 months in the first year it also guides us to titrate their estrogen dosing. So estradiol levels, which available naman po ito, total testosterone levels, SHBG, sex hormone binding globulins, and their albumin levels. Yan. So going to the trans man, dito si Priscilla, kasi ito naman yung born, sex assigned at birth is female and then identifies as male. So they seek masculinization therapy. So the goals include pwedeng i-ask mo yung client, development of facial hair, deepening of the voice, increasing body hair and muscle mass. Other effects would be redistribution of subcutaneous fat, change in sweat and odor patterns. You have to be able to counsel them dun sa mararamdaman din nila, the symptoms with the treatment: hairline recession, increased libido, amenorrhea, no menses, but maybe some of them, gusto nila yun, no, amenorrhea. Some are dysphoric with their menses, vaginal atrophy, and increased clitoral size. Yan. So the masculinization therapy generally causes temporary and possibly permanent decreased fertility. So yan, if they are to embark on cross-sex hormone treatment, pati yung fertility options nila is i-discuss nyo din with them, no? Lalo na if they have a partner, tapos they have plans of starting a family. Yan. So discussion about the possibility of continued ovulation is important for patients with sexual practices that leave them with the potential for pregnancy. So they should be counseled on current contraceptive options as well kung wala naman din silang not planning to start a family. Ayan. So contraindications to masculinizing hormone treatment, current pregnancy, unstable coronary artery disease, and polycythemia. And so this is an example of the different hormone preparations and their dosage regimen for masculinizing hormone therapy. Yan. Hindi siya available lang sa atin though commercially. So yan, so there are injectables, gels, creams, patches. Yeah, but in the Philippines, none are available. But naisip mo, ba't maraming trans man? Actually, pag nag-Shopee ka para may makikita ka mga testosterone medication. So talaga mag-ingat tayo sa ganito, So just go to a healthcare professional. Yan. So there's also a target range for the normal physiologic male range for testosterone. So you also have to, like in the trans woman, they have to be monitored also every test for hematocrit kasi polycythemia, every 3 months for the first year and once or twice a year thereafter. Yeah. So we're done with cross-hormone sex treatment. What about surgery? So if pwede yung patients kasi they don't want the surgical intervention, but some would, So some of the surgical procedures described here may not be considered within our scope as OBGYNs, kaya we will refer. But may be helpful for clinicians who will take care of a trans or trans clientele. So, ayan. So, preoperatively, a mental health assessment. Ito talaga kasi medyo permanent siya. So, a mental health assessment or clearance is required kung surgical intervention. Kaya lang, ngayon, blurred pa yan in terms of ethic and legal implications. Saka yung insurance, syempre hindi pa yan. Kung walang medical indication, for example, parang hindi yan cover ng insurance. So, masculinizing surgical procedures may include breast or chest surgery or mastectomy. Yan, genital surgery, hysterectomy, and self-ingo of with or without removing the tubes and the ovaries. Yan, reconstruction of the fixed part of the urethra, phalloplasty, yan, pwede ring mga vocal surgery para bumaba yung voice. Feminizing surgical procedures may include breast augmentation, penectomy, orchiectomy, removal of the gonads, vaginoplasty, pwede ding vocal surgery, thyroid cartilage reduction, gluteal augmentation. So there are many surgical procedures for our patients. So we also want, hindi lang naman tayo gender reaffirming healthcare, we also want them to be healthy. So screening and preventive medicine is also very important, particularly screening for malignancies. So currently there's insufficient data to determine whether our trans individuals are at risk for malignancy compared with the general population. But of course, meron tayong preventive medical care for them. So any anatomical structure present, kung trans woman siya, so born male but identifies as female, so meron pa rin siyang male anatomic parts. So kailangan ma-screen pa rin yun. So kung naman siya, kung trans man, born female, identifies as male, meron pa rin siyang cervix, di kailangan pa rin yun ng cervical screening. Yan. So for trans men, screening includes trans men. So these individuals were born female, identifies as male. Breast cancer screening, kung may breast tissue pa, cervical cancer screening for those who have cervixes. If they have undergone mastectomy and reconstruction, for example, there's limited data to support whether you have to have examinations pa for them. Yan. So they also need to undergo genetic counseling before the surgery if they have a personal or family history of breast cancer. Yan. Cervical cancer screening is performed according to age-related guidelines kung may cervix pa sila. So kailangan pa rin nila magpa-pap smear. For the trans woman, so these clientele were born male but identifies as female. So kung meron nagpa-surgery na siya, she has a neovagina. She doesn't require cytologic screen. Wala naman siyang cervix, so hindi siya magpa-pap smear. Hindi rin kailangan i-smear yung kanyang neovagina. But kung may prostate pa siya, kasi male siya, born male but identifies as female, prostate cancer screening should follow the recommendations kung ano yung sa cisgender man. So general consensus is that screening for breast cancer with mammography should begin after 50 years of age and a minimum of 5 years of feminizing hormone use. So sundan nyo lang kung ano yung anatomical structure present in your trans individual. So counseling, so this is also very important and part of their health care. So they should be counseled about the importance of routine preventive healthcare. Hindi naman nag-i-end sa nag-reaffirm ka lang ng kanilang gender. So they should be routinely screened also for intimate partner violence, depression, substance abuse, cancer and other healthcare needs, screening for sexually transmitted infections, and counseled about immunizations as well, including HPV vaccination. So contraception. So magtataka kayo, bakit naman may need pa for contraception? So gender-affirming hormone therapy kasi is not an effective contraception. No? Hindi siya necessarily will inhibit ovulation for those with ovaries. So sexually active individuals with retained gonads who do not wish to become pregnant or cause pregnancy in others should be counseled about the possibility of pregnancy if they are having sexual activity that involves sperm and oocytes. Ayan, oo. So, kailangan pa din, no? Fertility issues. So, ayan. So, before yan, embarking on gender-affirming healthcare, very thorough naman yung discussion, pati yung fertility issues. So, we should know and be aware of the patient's reproductive options. So, pregnancies are possible, no? Even after transitioning, especially kung medical, no? And perhaps kasi nare-reverse din no? Kung medical siya. Most important, contraceptive counseling is also kung importante yung preventing pregnancy kung ayaw pa nila magbuntis. So pati yung fertility fertility concerns nila. So fertility and parenting desire should be discussed early in the process of transition before initiating any form of gender affirming therapy. So you can have fertility preservation options for transgender individuals. Same siya for the cisgender individuals. So pwedeng, kasi for those with malignancies, pwede kang mag ovarian preservation, yan, oocyte preservation. Yan, pwede din yan. Kasi eventually baka naman gusto din nila to start a family. Sperm banking, oocyte preservation, embryo preservation, ovarian or testicular tissue prior preservation. Yan, so yun nga lang, yung kung surgical or what, hindi kasi siya covered by insurance pang ngayon. So as OBGYNs or any healthcare provider taking care of our SGM, particularly our trans individuals, it is our responsibility to educate ourselves, our staff, train them properly about appropriate language and the approach towards the healthcare and needs of our transgender and SGM patients. So that we are able to provide the best care for them. We should know which healthcare professionals also to refer to. No, kasi hindi lang OBGYNs yan, hindi lang internists, endocrinologists, but also urologists or surgeons, yan. So psychiatrists, no. So we are able to provide them clinical and surgical options. There are many therapeutic interventions available and sites wherein they can avail of our taking care of them. So of course, it always starts with respecting our patients, upholding their dignity, and providing care with competence and compassion, to be able to take care of them holistically. So we should always remember that in our clinic. So thank you very much. My references include, in POGS, we came up with a sexual and gender minorities primer, no, for our members. The WPATH Standards of Care is available online, and the ACOG Committee Opinion Summary on the care for our gender diverse individuals. So again, thank you very much for listening and take care.
Wow, thank you so much, Dr. Suplido. Lots of information packed into that short presentation. Very, very well appreciated po. You'll see all of the emoticons that you're seeing up here. Thank you so much for that presentation. I'm not sure if Dr. Amy will be able to join us given that she is boarding her flight right now. Dr. Amy, are you still there?
Delayed.
Hindi. Nasa bus gate ako. Anyway, how could I share my slide there? Okay lang ba?
Yeah,
Yeah,
sure.
can you hear me?
Yes, we can
sige,
hear you
please.
po. We can hear you po.
All right. Just tell me when to start.
Yeah, go ahead po. Go ahead.
All right, I'll share my screen. Can you see my slide?
Yes po. If you can just go to slideshow and then
Alright.
we'll start. Okay.
There.
Yes,
All
go
right.
ahead.
So what I'm going to share is, of course, somehow a supplement to what Dr. Shiri has already shared with you. no, this is to clarify the perspective on our medical issues, no, of the sexual and gender minorities, okay, which includes also, I mean, the members of, no, of the LGBTQI community. Okay, so I divided this into two, no, medical issues of sexual and gender minorities, those that are related to their gender identity, and those that are related to their sexuality, to their being homosexual, bisexual. Okay. So, as what Dr. Shiri has already mentioned, no, these are the issues, medical issues related to gender identity. We have the gender affirming care, under which we have the use of hormone therapy, gender affirming hormone therapy, and of course the procedures, no, the gender affirming surgeries, whether genital, which is the gender reassignment surgery, as what we called them before, and non-genital surgeries, which are your feminizing and or masculinizing facial surgeries. And then also we have the medical issues on mental health, which include, no, gender dysphoria. Okay, we have medical non-surgical gender affirmation, no, that can help, no, the particularly the trans women and trans men who have moderate to severe gender dysphoria. We also have the non-medical gender affirmation interventions. Okay. Then we also have the issues of depression. That these are referred, no, particularly to our mental health specialists, no, the psychiatrists and the psychologists. And then the stress disorders, which include, no, which also include the post-traumatic stress disorder, no, that they experience, and also includes the general minority stress. This could cause, these are caused by mental and physical abuse-related trauma, and this will also cause, no, secondary substance dependence and abuse. Then we have also bone health, no, related to hormone use, no, particularly erratic use of hormones. Sometimes they cannot afford the procurement of their hormones, and of course the necessary hormone suppression for trans women. Okay, this could cause problems in bone health later on, likened to osteoporosis, no, in menopausal women. And then the issues related to sexuality, you know, what we call bisexuality, homosexuality. You know, these include risks of acquiring STI, including HIV, the risks for reproductive organ cancers and other medical conditions, because the minority stress that they experience predispose them to poor health-seeking behavior. So cancers are diagnosed late, no, in the later stage already. And what, just like what Dr. Shiri has mentioned, no, the issues on fertility, no, impotence, and loss of sex drive secondary to hormone suppression. Okay. Sexual and gender minorities are have different sets of health risks, right, that we should address, you know, but we have to put into perspective, you know, this particular health risk and health issues, and then we could properly refer them, no, to their designated specialists. Thank you.
Wow, okay. Thank you so much, Dr. Amy. Hope you don't miss your flight po, no? And we hope you'll be able to well, share this in future webinars that will be showing po. On behalf of the on behalf of the team, we hope you have a nice flight. So that was ano po Dr. Amy Lopez, who is the chair of the project on sexual and gender minorities po. So maraming salamat po. So for our last presenter, siya po ang ating professor and vice chair from the Department of Obstetrics and Gynecology from the Philippine General Hospital, none other than Dr. Mario Festin. Sir Mario?
Thank you much, Raymond. Thank you for inviting us to educate the public about the sexual health division of the department. I will share my screen if pwede na. Okay. So, good afternoon to everybody. This is a reaction supplemental information to what Dr. Sherry Suplido and Dr. Amy Lopez had already presented in terms of the healthcare for our sexual and gender minorities. This is a relatively new aspect in healthcare, and there are many barriers which our clientele or patients face because of many unfamiliar things. Well, generally, all of this is under the big field of sexual health, which refers to a state of physical, emotional, mental, and social well-being in relation to sexuality, something related to your desires, related to reproduction. It is not merely the absence of disease, dysfunction, or infirmity, because we are now looking for well-being as well. So this requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So this is a broader, bigger description of what sexual health is. It's not limited for sexual and gender minorities, and it actually refers to all members of the population. But for this afternoon, we will be focusing, and we have been focusing, on the needs for the sexual health of the SGM. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. And this grid shows us the different rights, the sexual rights of all persons: right to health, right to live, right to education and information, right to privacy, right to decide the number and spacing of children, the right to consent to marriage and to equality, the right to be free from discrimination, the right to be free from practices that harm women and girls, and maybe sexual and gender minorities, and the right to be free from violence. These are sexual and reproductive rights. There are many, but they're almost basic now to the rights of people. Now, the ability to achieve sexual health is made possible through having access to comprehensive and good quality information about sex and sexuality. I am much older than Dr. Suplido, Dr. Amy, Dr. Sarmiento. Maybe Dr. Susie Mercado is about my age also, but a bit younger. And during my time, sex was taboo. Nobody speaks about it. Nobody knew how to speak about it. But we have to know about the risks persons may face and their vulnerability to the adverse consequences of unprotected sexual activity. So many things happened before that seemed to be out of control because these were related to sexual activity, and maybe part of the danger was also the lack of good information about sex and what to do when you have sexual problems. With that, we should also have the ability to access sexual health care. Kanino ka ba pupunta? Sino ba lalapitan mo? Ano ba yung mga problemang related to sex na kailangan mong patingnan? We are living in an environment, should be living in an environment that affirms and protects sexual health. Yung mga karapatan na sinabi ko kanina, dapat yun malaya mong gawin. So, we are aware of the growing concern of reproductive and sexual health morbidity. Yung sinabi ni Dr. Amy, that clearly shows that sexual health across all genders is an important health issue. So we are aware of unplanned pregnancy. Even those who belong to the sexual and gender minority could still get pregnant. Those, they could get sexually transmitted infections. They could have transmission of viruses that could lead to cancer. So all of those we should be aware of. There are many barriers to healthcare by the SGM. There is still a lot of stigma related to being in that group of persons, in that population. And there are many insecurities being faced by them because they don't know where to go, they don't know who to go to, and they don't know if they will be treated well. A big problem is that there is a lack of familiarity with terminologies, as what Dr. Suplido had already enumerated earlier. So, kailan ba gagamitin yung LGBTQIA+, may plus? Usually, this is the more familiar term being used by the lay persons. The SGM, the sexual and gender minority, are usually by the health community, but preferably we hope that more and more would use the SGM because it is more inclusive and less problematic. On the side of the health provider, there is discomfort with dealing with SGMs. This is because they don't know what the problems are, and they don't know, as what Sherry said, how to address them, how to talk to them, how to find out what their problems are. So this is the lack of awareness and the non-familiarity with their problems. Well, I know Sherry already described all the different new terminologies related to sexual and gender minorities, but even with the LGBTQIA+ group, there is a lot of confusion. So let me just add some more information and maybe reduce and not add to the confusion. So lesbian, female identified people reacted romantically, emotionally to other females. Gay, this used to include the whole LGBTQIA+ community before. Now this is a single individual who did not identify as straight, but are now more labeled for, or more referring to men who are attracted to other men in a romantic, erotic, or emotional sense. Bisexual is more expansive definition of bisexuality is somebody who is attracted to all genders, although at some point, some more than others at times. Transgender, ito yung medyo na-describe ni Dr. Sherry earlier. People whose gender identity and or gender expression differs from what is typically associated with the sex they were assigned at birth. So this is where you become the trans man, the trans woman. Now, where do the cross-dressers come in? Now, people who are cross-dressers are often not transgender, meaning they do not have to identify with a sex other than one that they were born with. So that if you're a cross-dresser doesn't mean you're automatically transgender. You might just remain who you are in terms of gay or in terms of lesbian or bisexual. Queer used to be also a common word used for everybody. These are sexual preferences, orientation, and habits of the not exclusively heterosexual and monogamous majority. Sometimes the Q refers to questioning which is questioning their place in the queer community, whether that means they are still unsure of their sexual orientation or gender identity. So I think they're somewhere in the middle, or deciding whether they will go into gay or to their original sexual and gender assignment. Intersex are born with reproductive or sexual anatomy that doesn't fit the typical definitions or male or female. So these are more medical in terms of the labeling. The A refers to asexual and later ally. Those who do not feel a sexual attraction to others. Does not include those who choose to be celibate, like some of those in the religious community. They're not asexual. They do not belong here. So asexual, no attraction to others. The ally is someone who confronts erotosexism, homophobia, biphobia, transphobia, heterosexual and gender straight privilege in themselves and others. So that is somebody who may need to be more defined and understood. There is a plus at the end of all those 8 letters that symbolizes and explains a number of different gender identities and sexual orientations that are not already present in the lettered acronym. So with all of these, we see that there is a lot of categories, lot of classifications. So it's better to understand which one belongs to where, and you can label the whole group as LGBTQIA+, or SSGM. As what we are being dealing the whole afternoon are the barriers to healthcare. So a big problem, the big ones are related to awareness, as what we have mentioned, and with discussing sexual and sexuality-related issues. We still have taboos in using local terminologies. Pag kausap natin itong mga pasyente, pag pumupunta sa atin, sinasabi natin are, pero ang pwede namang gamitin yung mga ginagamit nating mga salita like titi, like buki, like puerta, kasi yun naman talaga ang nasa Tagalog. Tiningnan natin ang isang direct dictionary na Pilipino, yun naman ang naandoon. Related to that is that there is inadequate training and confidence in the topic. Siguro kaunti lang yung oras na naibigay dito noong medical school sa mga doktor, tsaka hindi masyado maraming pasyente ang na-encounter ng maraming mga nag-OBGYN na naging espesyalista dito. There's also the perception that there are few treatment options. Siguro dun sa mga very complex cases, kaunti pa lang yung available. Pero kung doon sa maraming mga gusto lang na medyo lumipat, mag-transition, sinabi na ni Dr. Suplido kung ano yung mga possibilities and the treatment protocols. When we deal with such clientele, we should spend time. So the big problem is that many of the health professionals lack adequate clinical time in getting a complete sexual history. And dapat talaga busisiin, tanungin. At makaramihan dito mga sensitive issues, baka hindi comfortable, itanong ng doktor o nurse, hindi rin comfortable, baka hindi rin comfortable sumagot yung pasyente o yung client. Kaya the patient may be shy and reluctant to initiate the conversation. We should try to start it well, but we should know how to do it well. At the end of the day, it might need a multidisciplinary and interdisciplinary approach to management. This is from the CDC in the United States on how to take a sexual history. Very briefly, these are some questions we may ask when we are dealing with a patient and asking about the sexual history. we start with asking permission. May I ask you a few questions about your sexual health? These are personal, these are important. I will talk about your sexual life. What will that be okay? I ask this to all people, regardless of whatever their age, gender, marital status, are very important as to the others. Do you have any questions or concerns? Maganda rin na sila na yung magsabi kung may problema sila. Kung nahihiya na sila, we go to the other questions. But generally, there are 5 Ps. Dito sa Pilipinas, meron tayong 4 Ps related kung nangangailangan ka ng ayuda. Dito naman, may 5 Ps para sa sexual history. Tinatanong natin ang partners, tinatanong natin ang practices, protection from STI or past history of STI, baka dati meron sila, and their pregnancy intention. So even if they are from the SGM, they might still want to get pregnant, and there have been successful pregnancies even among the SGM. So these are the areas that you should openly discuss with patients. So are you having sex of any kind? Oral, vaginal, and anal with anyone? If no, have you had sex of any kind with another person? Have you had or sex partners? How many sex partners have you had? What are the genders of your sexual partners? Have you or your partners currently have any sexual partners? This is more related to the risk of sexually transmitted infections. Because even if you are having sex with the same sex, the same gender, there is still the risk of sexually transmitted infection. If a patient has had sex in the past but not currently, it's still important. Then, what kind of sexual contact do you have? Genital, anal, oral, tapos meron ding top or bottom. Kung ikaw yung if you have a penis, you're the one inserting the penis. If you're bottom, you're the one accepting the inserted penis. Then, sexual related to STI, HIV, SIV is still relatively low here, but noted to be slowly rising. Then, have you been diagnosed with STI or HIV? Your symptoms, etc. So we need to find whether you had been diagnosed and the treatment. And this is related to children. What kind of contraception are you using also? So sexuality in general entails a broad range of expressions of intimacy and is vital to self-identification, who you are. And this is highly influenced by our strong cultural, biologic, and psychologic components. Well, Dr. Amy, Dr. Sherry, myself, and Dr. Angge are OBGYNs. But all other health professionals play an essential role in assessing sexual function because many women look at their sexuality as fundamental quality of life issue. It is frequently affected by reproductive events. So healthcare providers should not make assumptions or judgments about a woman's behavior, should keep an open mind, do not react, and when providing counseling should bear in mind the differences in cultural, personal, and sexual practices. Many things affect sexual function and health: socioeconomic, medical conditions, intake of medications, even mental health problems. So these things we also have to ask. So that's all for my rejoinder for the sexual health and how it affects the sexual and gender minorities. Thank you.
Okay, thank you so much, Sir Mario. Great reaction po, and thank you so much really for just making sure that you're consolidated all of the presentations before you. You will see the emoticons that are popping up here in the Zoom webinar. So thank you so much. And thank you to all of our speakers, Dr. Suplido, Dr. Lopez, and Dr. Christine. At this point, we'll ask everyone in our panel to switch on your videos. But before we begin our Q&A, we will take a very quick break for a special public service announcement for today.
O sige na anak, parang kagat lang ng langgam. Kantik o yung kumikiliti lang? Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ko rin po ang color nito. Pero ayoko po ng red huntik. Masakit kumagat at takot rin po ako sa blood. Magtutugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O, heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love. Thank you, Doc.
Thank you, Nay.
Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Okay, thank you so much, TVUP, the COVID Communication Public Service Announcement. That's one of the many outputs po of our Stop COVID Deaths webinar team to push for vaccinations po for everyone. So we recommend everyone to take their vaccinations. We hope you're all able to share this video clip with all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay. Thank you. So for our very first question, we'll take one of those. So we have Dr. Suplido and Dr. Festin joining us in the Q&A. Our upvoted question here, I'll pose it to Dr. Sherry. From Dr. Tortona, are there any plans to require private and public schools to put up trained counselors' offices for sexual and gender minorities? Anything that you might have heard or your recommendations regarding that, Dr. Supli?
Well, we hope for that, no? We want to raise the awareness of everyone. Baby steps pa lang po kami. So, beginning in our society, the Philippine Obstetrical and Gynecological Society, and here, at least in the Philippine General Hospital. So, sa ano muna, I guess sa members muna namin, ano, kasi even the healthcare professionals, hindi din pa, or all the OBGYNs, not all are aware on the approach to the healthcare. And then after that, we can, so the residents and then the medical students, yun. Tas until siguro maging widespread na din po yung ano, no, until hanggang sa curriculum of the
Can I add to that?
Yes, sir.
Go ahead, sir.
The teachers and the guidance counselors in the schools should probably be aware of all of these issues so that they know how to handle. It might not be good to have a special person just for them. It should be part of the general competence and skills of all doctors and guidance counselors, because we don't know who are the persons who will be feeling this way, and still there is a lot of stigma. So if there's a student who goes to a special person dealing with sexual and gender minorities, baka pagkantsawan tsaka mas stigmatize. So it's better kung it's part of the general competence and skill of teachers and guidance counselors in schools as well.
Thank you so much, Sir Mario. For our second question from Riza Relova, how young or at what age can hormonal or surgical mga gender affirming treatments po be given? Is there a need for parental consent, especially for minors? How about psychiatric assessment? Is that required po? Go ahead, Dr. Suplido.
So usually minors cannot give the informed consent kasi until they turn 18, no? So they can only give an assent, a verbal assent, and then their parents will give the consent. But usually for adolescents, nako mas ano pa yon, no? Mas mahirap pa yon, no, for adolescents. So usually we really refer to a psychiatrist or a psychologist to counsel them, no? Kasi usually kung very young, pwedeng hindi pa stable yung gender identity nila, no? So dinedelay talaga yon unless they're very dysphoric. Hormonal treatment is started on them. Pero usually counseling talaga yan. Counseling until na mas na sila, late adolescents na sila. Kasi doon pa lang parang pwede maging stable yung concept nila of gender identity, no. So matagal na counseling yan with a psychiatrist. And then for surgery, depende sa kung ano yung part, no. So usually pwedeng kunwari genital, ganyan, 21 years old when all the secondary sexual characteristics yung talagang develop na. Kung mga bone pa nga yan for the plastic surgeons, parang kailangan maano mo na yung complete yung bone development and everything. Pero usually, hindi talaga sobrang ine-encourage yung adolescents for the surgical intervention, no. More for the hormonal and if they are extremely dysphoric. But if not, they undergo a lot of psychiatric counseling from the mental health specialist. But to answer, assent lang kasi hindi pa sila makabigay ng consent until they're 18. So parental consent.
Okay. Sir Mario, anything to rejoinder?
It's really more favorable if counseling takes precedence muna because there is dapat may firm decision na talaga and may firm consent on the part of the individual. So there's still some regret later on, lalo this is permanent and so dapat very very sure. So even for medical, the medical will still be reversible after a certain period. But for surgical, that is really more definitive. So talagang pag sure na talaga, doon na lang siguro. Plus, if it's surgical, may budget yan kailangan kasi hindi yan covered by our insurance system. So kailangan pag-ipunan mo.
Okay.
Yan.
Okay, thank you, Sir Mario. I have two questions. So first question naman po, it's a phone-in question. Ginagawa daw po ba yung mga ganoon like surgeries in the Philippines? That's one. Second question would be, are there any guidelines? So any specific guidelines po with regards to prenatal care or pregnancy for LGBTQ couples or individuals, maybe transgender individuals and same-sex couples daw po?
Okay, so to answer po kung ginagawa siya, no? Although hindi siya, sir, marami ng gender-affirming healthcare na surgical here in the Philippines, pero quiet lang, no? Hindi siya yung parang very much talked about. We have had may mga nag-train na po sa atin, no, na abroad meron silang skill and then they go back here. May nagtanong nga sa akin kasi nag-train siya for top surgery, tapos tinatanong niya ako, ma'am, ano na ba to, yung pwede na ba, parang is it ethical and is it part of like the guideline? Sabi ko, actually sa Philippine Obstetrical and Gynecological Society, yung surgical medyo blurred pa, no? We can only do, for example, for a trans man, hysterectomy only if there is a medical indication. So kunwari, meron din siyang pathology like a myoma, or you remove the ovaries if the ovary has a pathology. Pero yung for purposes of gender affirming therapy, hindi pa namin maglalabas pa kami ng guideline on that. Ang sinabi ko doon sa isang plastic surgeon who studied abroad, top surgery, went back here, I think their society should make guidelines also on that. Pero marami na po ditong gumagawa ng top surgery, bottom surgery for the purpose of gender-affirming healthcare. Pero medyo hush-hush siya. Hindi pa siya, you know, yung parang katulad na, oh, pumunta ka dito, ganun. Medyo hush-hush pa siya. And then the second question, ano nga ba yung second question?
Second question po will be guidelines or any specific details on pregnancy-related or prenatal care for same-sex couples, transgender individuals, LGBTQ community members.
If it's prenatal care, it's the same for a cisgender woman. No, so maybe then if there are nag-undergo na siya ng treatment or merong let's say hormonal treatment, pwedeng maging may possibility na high risk yung pregnancy niya. Same the guidelines are the same for cisgender at saka trans individuals or our gender non-conforming individuals. So the OBGYN will take care of that. Pero walang kaming specific guidelines na pag nabuntis ang ganito yung gagawin. Parehas lang. Their risk will be the same.
Okay.
For adverse perinatal outcome. Yes,
Thank you. Thank you, Dr. Suplido. With regards to, ito ba, probably our last question, given we're pressed for time. Any legal or policy changes that the POGs face or you still continue to face with regards to caring for LGBTQ patients in your field po? We'll start with Dr. Festin.
Well, legally, wala pa tayong laws related to that. But we actually have patients right now. So the legal aspect for that is we have to take care of them and we have to be aware of what their problems are. So what the legal protection we have will take time to develop, and the POGs will definitely be involved with that. But as what Dr. Sherry said, baby steps tayo, but later on, toddler steps and later big leaps ang kailangan gawin, especially with the protection of this clientele who really feel that this is where they belong, and also for the physicians who are willing to help them. So we're getting there, but we have to take care of them for the meantime. Especially marami na yung nagpuntang abroad, especially tayo. Ang daming pumupunta doon, then they come back here because they're not necessarily performers. They're actually living normal lives, but they just want to be like what they want to be. So they're having regular lives. So we have to help them when they have problems. Sherry, maybe your turn.
Thank you, Sir Mario. Dr. Sherry?
Yes, I totally agree with Sir Mario. No? Super bait. Gaya mo sa amin noong 2018, kahit na awareness lang, no, yun lang yung goal namin for all the POGS members at least. Baby steps and then toddler. I think sir nasa toddler steps na kasi nga we want to make we introduced the primer noong 2018. So kahit paano may introductory, and now may second second installment about yun na yung surgery and also, pero medyo i-develop pa po talaga natin yun, no? Kasi maraming legal implications, tapos yung use of their insurance and everything. Ayun po. So anyway, tuloy-tuloy pa rin naman po kami sa POGS to help our
But we are working with plastic surgeons, with urologists, with psychiatrists. So as I mentioned, multidisciplinary, interdisciplinary approach. Hindi lang sa OBGYN yan. Kaya lang, marami sa kanila pumupunta sa OBGYN.
Yes, sir. Trans men and women actually po pumupunta sa OBGYN. Pero marami din sa endocrinologists, and yung mga adolescents sa psychiatrists sila, no? Doon sila unang pumupunta. Yung psych ang nagre-refer actually sa atin po. Opo.
Okay. So that should be it, I think, for our questions po, no? But before we conclude our program, we'll go muna dun sa our fun quiz. Can we have it on the screen? Both on Zoom and on Slido po, no? For I'll ask each of you one question para po we're able to put, can we have the one on Slido po on the screen also, TVUP team? So while they're pulling it up, the very first question that thank you, that they're seeing on the screen, this will be for Dr. Suplido. What screening tests should lesbians undergo? Is it A, pap smear, B, breast exam, C, bone mineral density, D, all of the above, or E, none of the above? Dr. Suplido.
Okay, so the answer is all of the above, no? So meron tayo, because the lesbians are born female, tapos ang sexual attraction nila sa female or anyone who identifies as female. So kung ano yung structural anomaly that you still have, so cervix, if you have a cervix, kailangan mo pa rin ng cytologic screen like a pap smear. If you have breasts, then you need to have a breast exam. And then yung mga bone mineral density, actually for the post-menopausal or nandun na po yun yung, so age, dictated din. No, may guidelines for these preventive healthcare. So the answer is all of the above.
Okay.
Dun sa chat box, iba-iba yung answers eh.
That's true. That's true. We also have at least in the Zoom we have none of the above also those who answered. But at least in Slido, the 4 answered all of the above. For question number 2, for Dr. Mario, what is the best way for a transgender woman to have feminine features? Is it A, OCPs, B, oral estrogen, C, testosterone, or D, letrozole?
It's actually the oral estrogen kasi mas talagang feminizing. Ang ginagawa lang kasi nung iba is they take the oral contraceptive pills kasi mas mura. Tsaka they're more familiar with it because the estrogens are a little bit more expensive. So,
Yes, sir.
So dapat oral estrogen yung dapat inuin kasi yun talagang feminizing.
Okay. Thank you so much, Dr. Suplido and Dr. Festin. So very, very, very rich exchange of ideas and insights. I'll give you just a few minutes for a break, and while you're going into that break po, we'll have everyone go and answer our short panel evaluation poll that we have as part of our webinar. And while they're doing that, please take the time to come up with your final statements or final words that you would want the audience to take away from the webinar. So I'll read the questions here and then I'll go to each of you. First question, the panelists demonstrated thorough knowledge of the topic. So do you strongly agree, disagree, or strongly disagree? Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. We are not sending out a separate evaluation poll. This is the only one. So we encourage everyone to participate in this evaluation poll. We will not be closing it until the end of the webinar as we now move on to our parting words from our speakers. So we'll go first with Dr. Mario Festin. Your parting words, sir.
Thank you, Raymond, and thank you to Susie and all the other organizers of this webinar. We've been asking for this webinar ever since the Sexual Health Division was established, I think last year, and we're very happy we were accommodated. Mahaba ang waiting list for the webinar, so that I'm very happy for that because I've been watching this since the very beginning. So we hope that everybody learned about sexual health and with sexual and gender minorities, because this is a group that we really want to take care of right now, and we help them. So that's why we started this division in the department. So thank you very much.
Thank you so much, Dr. Festin, who is Professor and Vice Chair for Training at the PGH Department of Obstetrics and Gynecology.
Academic affairs, not training.
Our main presenter, who is the Chief of the Division of Sexual Health at UPPGH Department of OBGYN, Dr. Sherry Ann Suplido. Dr. Suplido.
Okay, thank you very much again for the opportunity to be here. So Our sexual and gender minorities clientele, they really, like I mentioned earlier, victims of discrimination and stigma, disrespect. So they of course they deserve the same healthcare as any of us. So as even not as healthcare providers, kahit na hindi ka nagpa-provide ng health, but more importantly for healthcare providers, we should be open, culturally welcoming, and kailangan yung mga biases natin sa mga sarili natin, tanggalin din natin po, no? Para we are able to care for them competently and with compassion, so that hindi sila matakot pumunta sa clinics natin pag may kailangan. Kasi saan sila pupunta? No? Tapos kung tayo pa pala yung nagiging barrier to healthcare. So I hope that this webinar, thank you. It's my first time here. Thank you for the opportunity po na raise po ang ating awareness on our sexual and gender minorities clientele. Sana po maging one po kayo with our advocacy in taking care of them. Thank you po.
Okay. Thank you so much. So as mentioned, we are also grateful to Dr. Amy Lopez from the Philippine Obstetrical and Gynecological Society. She heads, or she's the chair of the project on sexual and gender minorities po. And as well, again, our gratitude extending to the PGH Department of OBGYN, specifically the Division on Sexual Health. Maraming salamat po. Okay. So before we conclude our program, we have our closing remarks, our synthesis and closing remarks. However, I think si Ma'am Angge, Dr. Angela Aguilar, has scrubbed in to surgery. So we have, I think, a video presentation the TVUP team will show. Go ahead, TVUP.
Good day. This is a very interesting talk indeed, and our speaker and reactors have ably discussed this issue. I know we need more, but this is a very, very important start because the health of sexual and gender minorities is an essential yet underserved area in medicine. This talk outlines the concerns as well as the challenges all stakeholders face in addressing this need. Dr. Sherry Ann Suplidos guided us to the concepts we need to understand gender medicine, in the terms trans, cis, gender, and identity, among others. We are able to have an overview on how to provide the needs of this special population, be it gender-affirming surgery or hormonal management. Above all, we are able to understand that sexual and gender minorities are a unique population that requires not just recognition and acknowledgement, but also compassion, empathy, and active advocacy on their behalf. We applaud the Department of Obstetrics and Gynecology, Professor Sherry Suplido, and Mario Festin, and Dr. Amy Lopez for leading this bold and visionary progress towards bringing this topic out of the shadows, upholding its legitimacy, recognizing that it is not a niche area, but an equally important concern in line with obstetric emergencies, cancer screening, and fertility care. And with that, we are one in this advocacy, we are one in this science, and we are one in this goal to make sure that health for all is realized for all the members of this population in this world. Thank you very much.
Thank you so much to Ma'am Angge Aguilar. So as mentioned po, she's a special assistant to the Dean for External and International Linkages at the UP College of Medicine and the Philippine General Hospital. Okay, so thank you again for all of our speakers. You will note po, all of our speakers po are from are practicing OBGYN po, no? They're from the Philippine General Hospital and members po of the Philippine Obstetrical and Gynecological Society. You can still watch us po. For those who are asking, still watch us on the playback at the TVUP YouTube channel and at TVUP Signal TV channel 101 after this webinar. Next week, our webinar topic po, very, very interesting. It will be hopefully I'll have Dr. Susie back again. It will be led by Dr. Mingita Padilla, who's one of the leading ophthalmologists in the country. The topic will be status of eye banking and corneal transplantation in the Philippines. So please, wag niyo pong kakaligtaan na manood po next week. Very, very interesting again ang topic natin for September 15th. What you are seeing on the screen are the results of the panel discussion poll. So at least 94% of our respondents indicated that they strongly agree with all of the statements here. Just a testament to the high quality of our speakers in terms of the content and the delivery, and really very, very thankful to our distinguished panel of experts coming in for today. Before we conclude, our All Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. And you'll able to see it if you go to youtube.com sa app po, no? Or you could go to your browser, type in youtube.com/TVUPPH for you to be able to see all 161 webinars after today, maging 162 na po siya. We also have what we lovingly call SCD Shorts. Ito po yung mga selected presentations giving you nuggets of wisdom, a minute or so. Very, very short lang po ito that you can watch at your convenience, again, at the TVUP YouTube channel. So this formally closes our webinar for the week. Magkita-kita po tayo again next Friday. And obviously, it's a date. Together, we can stop preventable deaths. So keep safe, keep healthy, and see you online.